Hi, my name is Dr. Albright. I'm an orthopedic surgeon at Advantage Orthopedic and Sports Medicine. In this video, we're going to be talking about cartilage replacement and specifically the MACY procedure, which is the matrix-assisted autologous cartilage implantation. So cartilage replacement technology involves taking some of your own cartilage. So typically, what we'll treat with this type of procedure are zonal losses of cartilage. So for instance, a small area of cartilage loss, this is definitely not something that's designed to take the place of a knee replacement. But if people have these focal, what we call chondral defects or loss of cartilage, we can come to a less important area of the knee, typically in the notch, and remove some cartilage. We then send it to a lab in Cambridge, Massachusetts, where they can biologically amplify the cells. Once they've grown them, which takes a minimum of about 6 weeks, we then do a second surgery, which is an open surgery, to go in and reimplant the cells. And what's new about the MACY procedure, which is the matrix assisted as opposed to the previous version, which was just autologous chondrocyte implantation or ACI, is that now they've embedded your cells on a collagen mat, which we can put in the defect and seal with glue, and we no longer have to sew it, so it's a more accurate way to cover the entire surface. So cartilage replacement really involves a very select group of patients. It's typically what we call a focal chondral defect or a small defect within the cartilage. The surrounding cartilage needs to be intact. I almost think about it like a manhole cover in a street where you have good surrounding supporting material, but one area that's missing, because you really need three-dimensionally that structure to support the cartilage replacement. In those patients, we can sometimes lay in these cartilage mats that can regrow and recreate a patient's nearly normal cartilage. So the recovery from the MACY procedure, really there's two recoveries. From the first procedure, which is what we call the biopsy or the cartilage harvest, it's a pretty quick recovery, 2 or 3 weeks back to baseline activity. The second procedure is an open procedure. Many times it's not as straightforward as just recovering the cartilage. It's frequently necessary to do some bony realignment procedures, and those slow things down quite a bit. Typically, the rehab after the MACY procedure is a minimum of 6 months, but really more like a year for full activity. So it's a big commitment of time, but if you're able to do it and you can save your cartilage, then you're still dealing with your own materials as you age.